Which of the following is the most likely diagnosis atrial septal defect, coarctation of the aorta, patent ductus arteriosus, tetralogy of Fallot, and tricuspid valve abnormality? This is a 17-year-old male presenting to the physician with a history of progressive fatigue, palpitation, hollow systolic murmur at the left lower sternal border that increases with inspiration. An ECG shows a prolonged PR interval and a low voltage QRS complexes, atrial enlargement, and an echocardiogram confirms the presence of a congenital heart defect. We were given a left lower sternal border is kind of a location for the tricuspid valve, and high pitched hollow systolic, the tricuspid. I don't even think it's going to ask for regurg or stenosis, so that wouldn't even matter. So we've got the cardiomegaly and right atrial enlargement, which kind of goes with the whole picture of the tricuspid. Prolonged PR interval shows some sort of difficulty with the connection, I guess, between the atria and the ventricles, low voltage QRS. I guess like the ventricles aren't contracting enough. I'm not entirely sure. I mean, the murmur's not right for PDA. Tetralogy of Fallot would present as a kid. Atrial septal defect would present with the wide flick splitting, and coarctation of the aorta, it would have like the lower cyanosis and the upper like. So I mean, I'm gonna go with valve abnormality.
Yeah, bingo, right? It's at the right location, right? Going back, if you kind of draw this out, all right, always party till midnight is the one I use, right? So this is going to be your tricuspid area, right? Left lower sternal border, right? And then also on top of that, right, it's going to be a wholly systolic, right? Wholly systolic murmur, right? Usually it's going to be a tricuspid regurgitation, but you didn't have to pick here, right? And then of course, if you have regurgitation, then the right side of the atrial will enlarge because of the reflux of blood backwards every time that you have systole. But yeah, also on top of that, do you know any kind of weird symptoms you can get with atrial enlargement by any chance? I'm just curious.
Do I know how many?
No, no, no. What kind of weird symptom that you can get with atrial enlargement? Like if you have atrial hypertrophy?
Uh, Weird symptom. I can't think of one.
Yeah, that's okay. So you can get some dysphagia.
Oh, I've seen those questions. Yeah.
Yeah, because remember the atria are kind of like it's like kind of more your heart is tilted. It's not completely straight, right? So the atria, right, faces a little bit more posterior. So if you have a atrial enlargement, it can compress on your esophagus and cause you issues swallowing. So something
Yeah.
to think about.